Everybody, it's Dick Vaughn again with another Conversations With. And today I'm delighted to have with me as my guest today, and I'm sure you're going to enjoy hearing from him, Dr. Christopher Sharon. And Dr. Sharon practices in Charlton on Route 169. And you have an office in Connecticut too, don't you, if I'm not mistaken? Putnam, Connecticut. And Dr. Sharon is an ear, nose, and throat physician. And so I'm delighted to have him with me. Doctor, good to have you with us.
Thanks, Ted.
You know, one of the things that I don't think a lot of people realize is the connections between ear, nose, and throat. And it's all in one swoop. Tell us a little bit about it.
Well, they are closely related. It's not uncommon that we have someone come in with a problem in their ear, and it actually can turn out to be related to something in their nose. And there are other, sometimes general ENT problems like allergic rhinitis that will affect your nose, but they'll also affect your ears because the lining in those two areas is very similar. So you may come in complaining about your nose, and when we do an examination, we find out that you have a problem with your nose, but you also have something in your ear as well. Very common.
But you know, a lot of times people too is one of the things I always tease myself about my ear. I've always been trying to figure out a way to sell some of my wax to the Yankee Candle Company. I mean, you know,
people make a killing.
Yeah, I mean that's another part of the ears that a lot of people don't realize that those things produce wax.
They do, and it's normal.
Yep.
For your ears to produce wax. It's actually part of how your ear prevents itself from getting infected. But sometimes people make more than they need.
Yep.
And every once in a while it can cause a problem. So we'll have people come in who think that they have maybe a serious hearing loss problem. And it just turns out that they just need their ears cleaned. And for some of them, it's the first time I've ever had it cleaned, and they don't need it again for years. And other people need to come back in periodically, or sometimes we'll prescribe something for them that will help them manage it themselves at home.
But you were telling me about something else that you've zeroed in on, and we were chatting the other day. Talk about that special program you have.
Oh, so we were talking about balloon sinuplasty on the phone the other day. Yeah, so chronic sinusitis and other types of sinusitis are very common. It's extremely common problem in the United States. It accounts for thousands and thousands of doctor visits every year. And if you go to your primary care doctor, if you got pressure and pain in your sinuses or nasal congestion, a lot of times they'll start off by giving you decongestants, or if they think it's a sinus infection, they may go from decongestants and steroids to giving you an antibiotic if it lasts more than a week. But there are times where you've been doing that sort of thing for quite a while, and you need a little bit more intensive therapy. And so when your primary care doctor or you become kind of dissatisfied with that strategy, and it's been tried multiple times, they may get sent to our office. And so when people have had sinus pressure and pain for a few months and nothing's really getting rid of it, or if it happens, you know, a few times a year, year after year, and it's just not really getting better and staying better, and we like to avoid antibiotics, so sometimes we'll do something that's a little bit more aggressive. And we'll do a thorough evaluation. We'll do a physical examination. A lot of times we'll do endoscopy in the office to examine their nose more closely than you can do with typical instruments. Very commonly we'll get an allergy test to make sure that is not a huge factor. And other times we'll also order a sinus CT. But it can come to a point where, having tried everything else, we have to do something that's procedural. And you may have friends who've have had, or they've had a family member or friend have had a traditional type of sinus surgery, which can be very good, but often will involve some nasal packing. And maybe 30 years ago or so, they used to use a lot of packing, and that sort of became famous. So I'll have patients come in and say, "Oh boy, Doc, I really don't want that. My uncle had that, and he told me some stories. I wouldn't have that unless it was a last resort." And obviously through the years, just like everything else, technology, cars, everything, it's tremendously different now than it used to be.
Medicine, I mean, it's amazing. I was talking to a couple of friends in the profession, and I had an operation myself a couple of years ago, at Mass General for a femoral aneurysm. And the doctor who did it, Dr. Klaus, who is chief of vascular surgery, teaches at Harvard and at Mass General, told me that 2 years before, they didn't even do that operation. And he was going to do an operation that hadn't done before 2 years ago. It was that new. And he was one, and the funny part was, I have to tell you the story. He has, you know how they have your initials behind your name? Mm-hmm. Well, he had a bunch of initials in it, then said RPVI. So I said to him, I said, Dr. Darren Klaus, I said, Darren, what's the RPVI? Oh, Dick, I took a little test, and I passed. Well, I didn't think any more of it. I got home, so I looked it up. Well, it's Registered Physician for Vascular Intervention. That's what it stands for. He's one of 6 doctors in the country who does it.
Wow.
You know? So a little test he passed. But it's amazing how medicine has changed.
It really has. And that particular procedure is a lot different than it used to be.
Oh, yeah.
And we'll still do procedures in the operating room when people need that.
Yeah.
But the nice thing is now often you can have your sinus problems taken care of in the office with just a little bit of oral sedation and some topical decongestants and numbing. And we can, we'll usually need to do a few injections, but by the time we get to that point, you're usually pretty comfortable.
Yeah.
And there's a small specialized balloon that we can use to thread into your sinuses. It's an awful lot like angioplasty for your heart, but it's for your sinuses. That's why it's called balloon sinuplasty, similar name.
Yeah.
And when you open up the narrow openings of the sinuses at their natural anatomic exit, you can really improve airflow into the sinuses and allow mucus that gets naturally produced to leave more easily. And also, because you're increasing the diameter of that opening, when you get allergies or you get a cold, the opening is less likely to narrow enough to really close down and prevent the mucus from draining. Because it's that sort of a blockage that can lead to infections.
Oh, yeah.
And what this procedure is doing is it's helping to make your nose, your sinuses, more anatomically resistant to those infections. The nice thing is, though, is you're not going under anesthesia.
Yep.
You typically don't need packing when you leave. And the recovery time is closer to, on average, about a day and a half. Now, that's an average, right? So you have some people shorter, longer, some people longer. Yeah. I have had a couple of people come back and tell me they went to work that night. I would tell anybody who's listening, please don't do that.
Yeah. Give yourself
but those couple of daring people did it without necessarily mentioning it beforehand in at least one case. And certainly didn't mention it until the procedure was done. Yeah. And they were fine, but that shows that the recovery can be quick, but it is not what anybody should do. If you have this procedure, any procedure, you should follow the instructions, go home, rest. But typically when people do that, the recovery time is on average, about a day and a half. And it's a little quicker than the one you do in the operating room when you're removing tissue. Yeah. Because the healing is quicker, because really what you're doing is you're stretching things, spreading them out. Yeah. And so the recovery time can be a lot quicker. Right. And my experience has been that it's as effective as the one you do in the operating room. Yeah. No, but it's amazing. And I'm sure in your own career, it's amazing how rapidly we're learning new techniques and things are changing incredibly. I mean, we talk about how computers have changed the world. I mean, nothing's the same. I mean, here we sit, and newspapers are in trouble. I mean, computers have basically put them out of business. You know, but it's what it is. You know, at a time in our lives, they were the most important thing we could. My father couldn't wait to get the Sunday Globe. You know, now their readership is, and it's because now you can get any. Now the other problem is, and I always get a kick out of it, and I've had people do it to me. I'm on certain medications, and it's amazing to me how many friends I have that are really have missed their calling. They should have really been doctors. Unfortunately, they skipped medical school, but they still know, and they'll say, "Oh, you're taking that? Well, you should be doing this." Really? You know? Well, why don't you call my doctor and tell him that, will you please? Yeah.
And, I mean,
There's a lot of information out
a lot
there.
of information, yeah. And now they can go on and they go to, was it WebMD, and you can find out anything you want to know. They even tell you how to treat it, you know. And so I think sometimes people have to be really careful, you know, these self-diagnosis, and your best friend telling you what you really should do. You know, like going back to my friend Klaus, I said to him just before we were going to the operating room, well, what are you really going to do? He said, well, I don't know. I said, you don't know? He said, well, no, Dick, let me explain. I won't really know till I get in there. And we're going to have 3 surgeons. He said, I have 2 other fellows and myself. He said, the first surgeon just opens you. And it was 18 inches from here to here. He said, the second doctor will cut down to your artery. And that's when I come in. And he says, but I won't know until I actually get your artery and take a look at, now I know the measurements of the aneurysm, and I know we need to do work. But he said, there's 2 things I can do when I get there. If it's not bad, and he said, it's not really stretched, he said, I have synthetic skin that I can wrap right around it, tighten, and you're all set. On the other hand, if that's really stretched, then I'm going to take a piece right out, and I'm going to graft a brand new piece back in, and then put it back in. I said, and he said, I won't know that till I get there.
Until you get in and look, you sometimes
see
don't
what
know exactly what you're going to run into.
What I'm facing, you know. And so I, you know, when he first said it, you know, you don't know, you know.
Right.
And then he explains it. But everything went fine, and it was done, and he ended up with a graft. And so it's unbelievable, you know, the how things have changed. And I'm sure, you know, in your own personal, you know, medical career, you've seen things that have changed dramatically.
Absolutely. I mean, that particular procedure has changed a lot of things, and it's probably changed some of the people who can have the procedure. There would have been times in the past where maybe you would say for a particular type of patient, you're not going to do a sinus surgery on them because you don't want to take them to the operating room.
Right.
But I had a lady who needed a balloon sinuplasty a few years ago, and she said that every time she got a sinus infection, she'd get pneumonia. And the previous year, she'd actually been in the hospital a couple of times for that. And of course, I called her doctor, and we talked about her situation and whether he thought it would be fine for her to have the procedure in the office, and we did it. And I saw her son was also a patient. So we did her procedure. She did well with it. She was happy with how she felt when she came back. Most people will say that their symptoms are better, their pressure is gone. A lot of people will say, I breathe so much better through my nose. But she saw me a month after surgery and was doing well, but her son came back to see me as a patient about a year later. I said, how's your mom? And he said, great. I said, did she have to go to the hospital last winter for sort of her annual pneumonia? And she said, no, she didn't, because she's not getting any more sinus infections.
Wow.
Obviously, that makes you feel great. And that lady might have been someone who we would have had to just manage as the infections occurred rather than be able to fix them several years ago, because she would have had to have general anesthesia or something like that. And her primary care physician may not have felt great about her having an anesthetic. And anesthesia is great, by the way. They do a fantastic job. It's just that there's no one technique for anything that's perfect for everybody all the time, and it's nice to have other tools to
well, you know, I want to share a story, because last winter I told you the story, and I ended up leaving Harrington and going to UMass, and I was in the hospital for 5 or 6 weeks, and they cleaned out my lungs and fixed me all up. But as part of that, I was back in rehab, and I was there about 3 or 4 days, and I got a nosebleed, and we couldn't stop it. So they took me over to Harrington, and they cauterized it, and then I called your office, and I went in, and is it Williamson?
Jason Williams.
Jason Williams.
Yes.
He was there, and he came in and
great guy.
Yeah, he checked it all out. He did the cauterization and made sure it was all set, and then he told me about a product called, is it AID? A-Y-D?
Air gel, A-Y-R gel.
A-Y-R.
Yeah.
And he says, get that. And he said, that's going to be great, because, you know, I had all this mucus and everything. So anyway, but a product I wouldn't have heard of in 100 years, you know, and it works great.
It is.
You know,
saline gel, and it stays in there and softens everything up.
Instead, they were giving me sprays. He said, no, don't do the spray. Get the gel. He says, you'll be fine. And I've got it, and it worked, you know. And So you know, people don't realize the things that can happen with that nose, you know. And now, you know, let's talk about allergies, because right now all the trees are coming in, and you watch the news on the weathermen on TV, and they're telling you oak and this and that, and of course your nose is up,
Right.
you know.
Yeah, it's a pretty common problem, and I think sometimes people either comes on gradually and they learn to accept it, and they just sort of deal with it, and they'll actually do somewhat of a good job managing it with over-the-counter medications. But it can get to a point where you're either just sick of it, or it causes another problem, like sinusitis, or it can make other problems worse, like asthma.
Yeah.
It can exacerbate your asthma. And so we have a lot of people come in to get evaluated for allergies. And you know, we'll do our same sort of exam that we usually do. We have a very thorough exam when they come in that we do on everybody their first visit. But then we can do an allergy test, hopefully in the office, and find out what they're allergic to. Now, if I'm the patient, what I want to hear is, you found what I'm allergic to, and I can avoid it. That's really the home run.
Oh, yeah.
So if we find out that if you just have your cat sleep outside the bedroom instead of on the pillow, that's great.
Yeah.
We typically don't tell you to get rid of your cat, because there's sort of a you know, doctor joke. If the allergist tells the patient to get rid of their cat, they usually get rid of their doctor.
Yeah.
So we don't tell people to get rid of their pets. It's not very successful strategy. But if people can just avoid some of their exposure a bit, or if they can get a little less exposure to dust by taking some dust precautions in their home, if that fixes everything, that's fantastic. Now, sometimes that's not enough, and they'll have to get allergy shots.
Yeah.
And that's a little bit more of a time investment.
Yeah.
But so you're usually coming once a week for at least a few months, maybe longer, and hopefully over time we can taper it.
Yeah.
So you don't have to come so often, and hopefully over a few years you get to a point where your symptoms are well controlled. Now, the symptom control can come before that, but at a few years, sometimes we can repeat the test, your symptoms are controlled, your allergies are gone, and you don't have the problem anymore. So you basically have retrained your immune system to not be allergic.
Yeah.
Which is an actual cure in that case, and it's sort of a natural cure because it's not a pharmaceutical. The injection you're getting was developed from your test, and the things you're allergic to were used as ingredients in your shot, but they end up training your immune system to no longer overreact and be allergic, but to sort of calm down.
Yeah. Well, when I was a kid, I had asthma when I was a young guy, and my mother took me in those. I don't know if they still do it, but they did all these little pricks all up and down my arm and put little powder on it, and to see which. And I had eggs that morning for breakfast. So when I get in there, the thing, I guess eggs went boop, and my mother said, gee, he had them for breakfast. But over the years, because it's under my asthma now with the physician I have, is incredible. I take Montelukast at night. I have Flovent. I don't think I've used what I call my squirter, my albuterol, for 7 or 8 months. I mean, it's really, really got me under control. And in time, you talk about cats. I'm allergic to cats and dogs. Well, we had kids. I have 5 kids. Dad, we need a dog. Dad, we want a dog. Dad, we want a dog. And anyway, a friend of mine had a litter of St. Bernards. So of course they were adorable. But you know how kids are. It's like getting a pool. Dad, get the pool and we'll take care of it. And they do for the first 2 days.
How'd they go?
And then Dad takes care of the pool. So Dad, get the dog and we'll take care of the dog. Well, after about a week and a half, it was my dog. But anyway, but it was a St. Bernard. And of course they get big. Well, at first I had to really be careful. Well, just having him in the house, eventually my body became used to him and it didn't affect me.
Well, yeah, you're not the first person I've heard tell me that. It's typically not the way people recommend someone fix an allergy. The body's complicated.
Yeah.
I have had at least one other person tell me that they sort of apparently fix their own allergies by becoming accustomed to the exposure.
I didn't go near him, and if I touched him, watch out,
Right.
But I mean, but eventually, we had him for 10 years, before Bernards are wonderful, except they get old and they're back hinds go, you know, and before that happens, you got to do them in, because if you don't, if that leg cracks, the doctor said, Dick, you're not going to be able to touch him. He'll bite you because it's going to hurt him so much. And he weighs 150 pounds. You can't carry him. So we got to watch him until, and you could see him, he was slow to get up. So we took him over.
That's tougher to fix than your allergy problem, for sure.
But the point was, in my case, and I was really against getting the dog. Believe me, I was against it. But eventually, and it wasn't a week. I mean, it was years, 2 or 3 years. Eventually, he didn't really bother me, you know. And it's just that evidently my body got used to it. That's all. And I was on medication.
Sure. Yeah. Tough to make a recommendation based
I would
on that,
never,
because there's a lot of individual
do
stories out there.
Yeah.
They usually call that anecdotes in medicine.
One year I went down to we all were going to go to Thanksgiving at my son's house. This is about 4 or 5 years ago. And my oldest son, had a couple of cats. And he said, Dad, I got the room down cellar for you. Don't worry. It's perfect. It's downstairs. It's got your own bed.
Cat-free.
You're all set, yeah. I get in the bed. I'm in there about a half an hour. My eyes almost closed. I ended up sleeping in my Jeep in the driveway, all right? And I said, well, we figured out, they suddenly realized what happened. During the day, the cat used to go down there, get up on the bed, and that's where he took his little nap.
Nice.
You know, we didn't figure that out till after a while. But so it was a tough night for me. So it can happen. I mean, it really does.
And if you had a situation where you couldn't get away from the cat, that's when you might be someone who's going to come in and say, hey, Doc, can we check this out, because I need some help.
Yeah, no, I just went out and slept in the Jeep for the rest of the night, put the seat down and stayed in the car. And once I got outside and got some air, I was fine. But boy, at first it was unbelievable. So these things can really happen. And it all goes back to EN and T.
It does, yeah. In that case, it does. These kind of stories do, for sure. And that is the kind of stuff we do, and we'll do all ages.
Yeah.
And that's again, that's a very typical problem that we see in the office.
One of the things that we've often heard, and I'm sure it's true for you, is this. You know, one of the things that a lot of times people do is they'll get something, whatever it is, and they'll put it off and put it off and put it off, and the doctor will say, if you'd only come to me earlier, I could have helped you, you know, or I could have done this for you, and I don't know why that is, but people do it, and you hear the stories so many times. If they had just come when they first realized they had a problem,
right,
it would have been a lot easier to solve it.
Absolutely. Yeah, we'll get people who do that for different reasons. I think some people, honestly, innocently don't think that what they're experiencing is a sign of a problem. Yeah. And other people they're very busy. Yeah. There can be issues with insurance or finance or schedule. Yeah. And then sometimes people are scared. I've had a couple of people say, I know I should have came, but I was just so scared to hear that you were going to tell me what that lump in my neck was. Yeah, yeah. And you can completely understand why someone would be scared to get the news. But generally, it's better to get bad news early than get bad news late. Yeah. And we have seen that, unfortunately, a few times. And even more easily handleable problems like sinusitis, there's some evidence out there that says that if you've got the diagnosis of chronic sinusitis, you're going to respond better to a procedure if you get it a bit earlier rather than waiting and waiting and waiting.
Yeah. Now, let's talk about today, currently. Because of all the restrictions, what do people do?
Well, I think a lot of us have switched to phone visits and video visits, depending on the situation and depending on the specialty. Yeah. The video may help out more or less depending on what problem you're talking about and what your specialty is. We rely pretty heavily on physical exam, especially with the first visit. But in the case where it's really not a great idea for that person to come in, and it's not really an emergency, phone and video is what we're doing right now. Yeah. We still have people come in for emergencies. Or if we have a concern that you've got a problem that at night or on the weekend might end up putting you in the emergency room or urgent care where there might be more people, then we're going to try to help you out and get you in the office for that. Not because it's necessarily a true crisis, but because you're going to end up going to the hospital, which is
Anyway,
what you're trying not to do if you don't need it right now.
Yeah.
And so we are seeing people for those types of problems in the office.
Yeah.
And of course, I mentioned a lump in your neck, or when
Yeah.
someone's scared that something could be cancer. Of course, we still get those
So
people right in.
so
But we can
people can-
handle quite a bit over the phone right now.
Yeah, so people can get a hold of you. And,
Absolutely.
And you can see them.
Yes, we can. Yes,
Good.
we
Well,
can.
that's good
We just
news.
have to sort of, make
Work it out.
a
Because you
decision
talk about
on whether
the
they need
phone.
to come in physically or not.
And in my own case, I've got 3 or 4 different physicians that I work with, and each one of them have called to make sure I'm okay, And my PCP, we actually did a visit on the phone. Mm-hmm. He went through everything, each one of my
Just doing it
medications.
on the phone.
Yeah, right, did the whole thing
Right.
on the phone. And I have a thing that you put on my finger, gives me my oxygen level and my
Pulse ox in your pulse, yeah.
And he said, do that for me, and we have a blood pressure machine at home, so I gave him that information, and then a thermometer, and he was thrilled. In fact, today, with what's going on, I do the thermometer 3 times a day, morning, noon, and night, and as long as I can stay around 97.6, I'm a happy clam.
And I think a lot of doctors are managing things like that.
Yeah.
Sort of at a distance to get you what you need, but keep your exposure risk.
So let's talk about you're located. You have an office in Charlton.
Yeah.
On Route 169.
Yeah. 246 Southbridge Road.
Yeah. And
we have one at 145 Pomfret Street in Putnam.
Yep.
And when it's not pandemic time, we are there, 5 days a week.
Yeah.
And I have a nurse practitioner, Lorna K. Murdoch, in my Putnam office. We have Jason Williams, my PA, in the Charlton office. And we're there just about 5 days a week most of the time. And right now, like I said, obviously, most of our focus is keeping people from having to come to the doctor. But those are our locations.
Well, and it's important. It's important that I think the reason I wanted to have you on is so you can chat about this, because I think it's so important for people to understand that there's help, and it's right here, and your practice here in Charlton, and you can help people if they have ear problems, nose, throat, and you're ready to go for them, and I think that's important. So all they have to do is get a hold of you, look you up, and get in to see you, and we can go from there, and really take care of them. Well, it's been terrific. I'm so happy that I got a chance to have you come in. I know you're a busy guy normally, and
right.
and well, you got 2 offices, and you're running back and forth, and so you're busy, and that's the important thing. That's the good news. You're busy, but we finally got a chance to get you in, and I'm so glad we did, because we've had a chance to talk to folks about ear, nose, and throats, and there's help right around the corner.
Right around the corner.
Right around the corner. So, Dr. Christopher Sharon, my pleasure. Thank you so much for being with us.
Thank you. Thanks for having me on.
Yep, I'm happy to hear that. And there you are, folks. That's another Conversations With.